Can PTSD cause bipolar disorder? Have you ever wondered about the connection between post-traumatic stress disorder and bipolar disorder? While they are distinct mental health conditions, research shows that they often occur together. However, it is important to clarify that PTSD does not directly cause bipolar disorder. Instead, PTSD may increase the risk of developing bipolar disorder in some individuals, particularly when trauma is involved. Let's dive deeper into this relationship. Studies indicate a significant rate of comorbidity between PTSD and bipolar disorder. Estimates suggest that between 4% and 40% of individuals with bipolar disorder also meet the criteria for PTSD. Conversely, a notable number of people with PTSD may also have bipolar disorder. This overlap highlights the complexity of these conditions. Psychological trauma, which is central to PTSD, plays a crucial role in the development of bipolar disorder. Childhood trauma, in particular, has been linked to a higher risk of developing both PTSD and subsequently bipolar disorder. This suggests that traumatic experiences can influence mental health in profound ways. Both PTSD and bipolar disorder involve dysregulation of the brain's stress response systems and abnormalities in neurotransmitters like dopamine and serotonin. These shared neurochemical pathways may help explain why one condition can increase the risk of the other. Individuals who experience both PTSD and bipolar disorder often face a greater symptom burden and a lower quality of life compared to those with just one of these conditions. The presence of both disorders complicates treatment and can lead to more severe clinical outcomes. It is also important to note the directionality of this relationship. While PTSD may increase the risk of developing bipolar disorder, having bipolar disorder can make individuals more vulnerable to traumatic experiences, potentially leading to PTSD. This bidirectional relationship suggests a complex interplay rather than a simple cause-and-effect scenario. When it comes to diagnosis, the overlap in symptoms means that careful assessment is necessary to distinguish between PTSD, bipolar disorder, and their co-occurrence. Managing both conditions requires tailored approaches. Some treatments that are effective for PTSD, such as antidepressants, may trigger manic episodes in individuals with bipolar disorder if not carefully managed alongside mood stabilizers. Given the complexity of co-occurring PTSD and bipolar disorder, seeking professional mental health care is essential. Accurate diagnosis and appropriate treatment planning can make a significant difference in managing these conditions. In summary, while PTSD does not cause bipolar disorder, trauma-related PTSD can increase the risk of developing bipolar disorder in some individuals. The two conditions share overlapping symptoms and biological mechanisms, often co-occur, and together can lead to more severe clinical outcomes. Understanding this relationship is key to guiding better diagnosis and treatment strategies. Always consult with a healthcare professional for personalized advice and support.